So it's my great pleasure to introduce Dr. Megan McGinn today. Before I do the official introduction, I do want to thank her and let people know it's been my privilege to work with Dr. McGinn for many years. She's really outstanding, a lot of fun, a real subject matter expert, and I feel quite privileged to call her a friend of mine. So with that, Dr. Megan McGinn is a clinical psychologist who specializes in couples therapy delivered via telehealth. She has published on relevant topics such as clinical and ethical considerations for delivering couple and family therapy via telehealth and recommendations for using video telehealth when patients are at high risk for suicide. She completed her doctoral studies at UCLA and her pre- and post-doctoral training at the Seattle VA. She previously worked as a staff psychologist at the VA and is assistant professor at the University of Washington School of Medicine and Department of Psychiatry and Behavioral Sciences. She is currently pursuing a career in private practice. She is an expert in integrative behavioral couple therapy and passionate about making couple therapy more accessible through technology. So with that, I'm going to shut my big mouth here and turn it over to Dr. McGinn.
Thank you, Brad. Well, I will go ahead and jump in. So our objectives for today are to answer some of the following questions. So does the research evidence support the use of telehealth with couples and families? What are some of the unique benefits of telehealth with couples and families? And what are some of the unique challenges that exist in delivering couple and family therapy via telehealth, and how can we more effectively address those challenges? So, diving in then to our first question about the research evidence. So by now, you probably know that there are two types of studies that can tell us something about whether we should be using telehealth with a given population, in this case, couples and families. The first is, your typical clinical trial that tells us whether a treatment is efficacious. And then the second is a non-inferiority trial that tells us whether the outcomes for telehealth treatment are equivalent to the same treatment delivered in person. So in the case of couple and family therapy, there is very little of either of these types of studies. But we did have a systematic review come out this year that included 28 studies. You can see from the breakdown here that most of those studies were with parents and their kids. And there were 5 studies that included adult dyads. Most of these were, kind of more like a caregiving role. So, a patient with TBI and a spouse or caregiver. So really very little empirical evidence specifically for, kind of relationship therapy type couple therapy. That being said, what we have learned from this review is that, all of the studies included demonstrated improvement in at least one mental health measure. And the few studies that did compare to an in-person group as their kind of control group found no differences in the outcomes between them. Actually, with one study showing a little bit of better outcomes for telehealth on a measure of depression. As you, again, probably know by now, one of the main benefits of telehealth to clients is that access to care piece. And when it comes to work with couples and families, there are some unique barriers to care that can be addressed, at least in part, by using telehealth. For one, it can be hard enough for one person to schedule a therapy appointment. I'm sure you've had this experience of trying to just match up therapist schedule with patient. But then when you're including multiple people for an appointment, it becomes that much more challenging. And telehealth can help with that by things like, cutting out commute times, It can even be possible to meet with family members in different locations. If that's the only way to make it work. And therapists can sometimes even offer more flexible hours via telehealth, if they're not having to kind of travel to and from an office to deliver the service. So there are many ways that the scheduling piece may be a little bit easier with telehealth. Childcare becomes another big piece. So if you're doing a couple or family therapy that does not involve all of the children or any of the children, it can certainly be cost prohibitive or just very challenging to find childcare for that time period that you're going to be in session. And telehealth can help to alleviate this somewhat. Again, without the commute, it shortens the amount of time for which you need someone to watch the child. Maybe it's possible to, have a neighbor for an hour versus, kind of having to ask them for a half day that it would take you to get into the hospital and leave. So it can be helpful in that way. Or in the case where childcare is just not an option, you can do some, kind of creative scheduling around a nap time or, some strategic use of screen time or those kinds of things that can really help, families that otherwise wouldn't be able to get in for treatment to make that a reality. Telehealth can also be really good in situations where, everyone involved in the therapy is not in the same physical location. So whether that's, somebody is hospitalized or incarcerated, or in the case of long distance relationships, for whatever reason. Many times the preference is for having family members in the same room. But again, just thinking about that access piece, there's just a lot more that's possible with telehealth than in person. Aside from those access benefits I've already mentioned, there are other benefits to telehealth with families. So compared to telehealth with individuals, having another family member there means that there's somebody that can assist in the case of an emergency. Family members can also provide some of the feedback about other members' nonverbals. So if you are, kind of subtly missing something, it may be that a family member brings it to your attention. So that can be a benefit in comparison to individual telehealth. It also allows families to connect with a therapist with specialized skills or experiences. So, if, for example, there was a therapist that specialized in working with families where, one member was gender transitioning, a family that was in a community that did not have someone with that specialty could connect to that specialty. So it really allows for some of that specialization to occur. There can also be benefits to the therapist, seeing behavior in the home environment. Sometimes you're learning things that you would not learn otherwise, as I'm sure many of you have had the experience, working with individuals as well. But that can be a benefit to kind of see people in their home environment. Another benefit brought up in a paper was that the limits of technology can actually encourage turn taking in individuals who may have a tendency to talk over one another. Because as you may have noticed in your countless Zoom calls that you've had to take since the pandemic started, talking over each other doesn't really work. No one gets heard. It kind of cuts somebody out. So you really have to take your turn to speak in order to be heard. So there can be some kind of a natural benefit there that occurs over the technology. And also for some people, that physical distance, either from the therapist or in cases where they're meeting from where the family members are meeting from separate locations from each other, can sometimes make it just a little bit easier to approach some difficult topics. There's been some kind of anecdotal reports on this, around cases where, a child hospitalized with anorexia being able to kind of finally have some conversations with family members because they weren't physically there in the room, having that kind of intimidation factor, but having that facilitated over telehealth. So in some cases, it may be just easier to approach some topics with a little bit of that distance. So I would argue that there are a lot more benefits than downsides to offering couple and family therapy via telehealth, but there certainly are some unique challenges that sometimes require some creative solutions. So to get us kind of started thinking about this, I'm going to do a quick little audience participation piece. I'm going to present 2 case examples, and you can all answer in the chat function if an idea comes to you about how you might respond in this situation, or how you might do something differently to prevent a situation like this. So here then is the first case example. A family therapist has a first session with a family consisting of a mother, father, an adult son returning from college, and a high school age son. The therapist intends to observe the family's natural communication styles during this first session. However, the session devolves into a screaming match, and the adult son actually mutes the computer so the therapist can't hear what's being said. So it'll give you a chance to kind of mull this situation over and think about ways you might respond or ways you might do things differently to prevent something like this. And I think, Kara, you'll let us know if somebody is responding in the chat.
Yeah, I'm not seeing anything yet, but yeah, please, folks, go ahead and type in things to the chat and we'll read them out loud. Oh, okay, here we have one. From Joshua, setting ground rules prior to starting, asking family members to shift to individual computers and continue. Sounds like a good plan. And he adds 2 separate interventions. From Joseph, firstly, the family therapist should be the host, so he or she has control.
Mm.
Any other thoughts from folks out there? Sounds like a challenging situation. Deborah says ground rules, using phone in if need be.
Yeah, these are some great ideas. I think, a lot of people have had to kind of adopt telehealth on the fly in the past year and a half. And so some of these things that may seem obvious to us as a telehealth provider, like make sure you're controlling the mute, right? May not be for everyone. And I think this, I'm not sure what the therapist did in the moment, but the authors of this paper suggested that maybe even thinking about kind of changing the way that you order sessions. So maybe it would make sense to have an individual session with each family member, so you're kind of building that one-on-one rapport before bringing them all together to kind of see how they're interacting as a family. That would also give you a chance to kind of go over those ground rules and so forth, and make sure you get each person's real buy-in to that before you're, doing some of that observation.
We have a couple more comments.
Yeah.
Megan, from Emma, reminder of coping skills and discuss everyone's reactions and feelings when that incident happened. Mm-hmm. And from Amanda, acknowledge the situation and grow from it.
Absolutely. Yes, this would definitely be the kind of thing that you are bringing up with the family to kind of discuss how you're going to handle it in the future, for sure.
One more, validation about the challenges they're facing and acknowledge their bravery in showing what is really happening in the home.
Yeah.
Oh, initially ask family members what their expectations of the session are.
Mm-hmm. Yeah, these are all great suggestions. Yeah, and you can see, you know, how this would be a challenging situation even if you were in person, but just kind of the added aspect of telehealth and not being able to intervene in the way you normally would means you have to get a little bit creative. I'll go then to the second case example. So a therapist is providing feedback to a couple after meeting with them for a few assessment sessions. One of their presenting problems is a disagreement over how to handle the problematic behavior of a female extended family member. As the therapist is about to discuss this problem in the feedback, a female adult unexpectedly walks behind the couple on her way to another room. What would you do? Or what could you do differently?
Okay, one comment, clarify with the couple if this is an okay time to continue the session, given the ability to be overheard.
Mm-hmm.
Any other thoughts from folks out there? Sounds like a somewhat awkward situation.
Mm-hmm.
Remind in advance of the couple to have a session in a private room. Ask about the confidentiality of the location, see if privacy might be able to be increased by moving to a new room, closing the door, etc. Clarify ground rules, ensuring privacy.
Yeah, great. Yeah. So a lot of these kinds of scenarios can be helped by kind of setting expectations up front before you're having sessions, you know, about what your expectations are for privacy and what you expect to be alerted to if there is, you know, somebody else that could be interrupting.
One more comment that kind of speaks to that. She says, Deborah says, good to have a plan in the telehealth consent about how you would deal with privacy or tech issues that might pop up.
Yes, absolutely. Yes, and we'll get into some of this into more detail as well moving forward. Thank you all for your thoughts. So yeah, I mean, those were all really excellent ideas about how to deal with some of these situations. And I'm going to talk more specifically now about some of the areas that you know, can bring up concerns for couple and family therapists when we think about doing this work with couples and families. These categories below or in the slide come from a paper that I wrote with a colleague, Elizabeth Rapp, who's done in San Diego. And all of the, or most of the recommendations then on the slides that follow come out of that paper. So I did include then recommendations from others that have added to the literature that since then. So in those cases, you'll see a citation, but otherwise it comes from this paper. Those areas that we'll cover are privacy and confidentiality, safety, management of multiple patients in session, kind of concerns around the therapy process, and treatment planning. So getting into that first area around privacy and confidentiality, certainly that case example spoke to this to some degree. You know, some of the privacy and confidentiality pieces are going to be common to all telehealth, you know, things that you've heard about before, making sure that your, you know, software and hardware are encrypted and all of those types of things. We won't cover some of that more general stuff, but when we think specifically about couples, working with couples and families, that concern about presence of others in the home, you know, in the case example I just had, it turned out that the other person was a home health aide. So, you know, the couple was just not concerned about talking in front of this home health aide for whatever reason. But, you know, we may have concerns as a provider, not knowing if there is somebody else that's overhearing our conversations and not knowing what impact we could be having. Another area where this comes up a lot in families is with, you know, children at home, children that aren't involved in the therapy. And so, you know, there are topics that we may not want to be discussing in front of children because it's not appropriate. Sometimes children can be very distracting and, you know, really serve kind of an avoidance role for the couple so that they're not getting into particular topics because they have worries about being overheard. And so, you know, that can be a challenge. The other piece we think about is our measurement confidentiality. So this, you know, there may be times that we are giving the family members measures to fill out that we would like them to fill out separately and not share their responses with one another, whether that's for some sort of safety reason, like we're assessing violence, or even just to not kind of influence each other's responses. And so, you know, kind of thinking about what are our options for giving out these measures that we would normally do in person just by having them fill it out in the waiting room and then bring it in to us. You know, when we don't have that kind of easy option, what can we do? There are a range of options, right? Ranging from good old snail mail, which has its benefits in terms of, you know, confidentiality. People can fill it out, put it in an envelope, send it off, but of course, quite a time delay. There are different ways of electronically getting information. You know, with something like email, we have to start thinking about HIPAA and, you know, are things appropriately encrypted? Secure messaging options can be a great way to get measures back and forth. But, you know, in some systems that may be more or less feasible to have both, you know, all family members have their own way of delivering something securely. I know when I used to work in the VA, it was only the veteran that had access to the secure messaging. So, you know, the veteran could take the partner's questionnaire and send it in, but then, you know, again, you're kind of losing that privacy piece. Another option is to, you know, hold measures up to the screen. So fill something out, hold it up so that the therapist can kind of jot things down. Sometimes that can be challenging to see. They can present measures verbally. That has its own challenges. So again, then you're kind of possibly influencing the other person's responses when you're sharing the information that way. And, you know, you don't get that privacy to ask questions that, you know, you would really like to have answered without the other partner being privy to that response. So a lot of kind of areas in here that, you know, bring up concerns for clinicians. In terms of recommendations, you know, the big piece, a lot of you mentioned it, is that informed consent process, right? So we don't have total control over who is in their space. We just don't as therapists. And so the patients are really largely responsible for protecting their own privacy, but we want to set expectations with them right up front that we expect them to do that to protect their own privacy. And at the very least, to let us know if there's some sort of unexpected interruption in the room that's outside of our field of vision. You know, we do want it to be an ongoing collaborative problem-solving situation. So, you know, in our case example, we can kind of work through with them what's the time of day that the home health aide is not in the house. So, you know, when might we reschedule our session so that, you know, we can have privacy? You know, are there other ways of making that happen? Other rooms, other, you know, headphone devices for kids, so on and so forth. Certainly, it's reasonable to consider working some of this into your consent form for therapy, or at the very least documenting that you've had these conversations in your notes so that it's, you know, clear that you've really been thoughtful about this area. And then as much as we want to be flexible, that's kind of the name of the game in couple therapy, we do want to hold some boundaries with regards to the presence of others, you know, especially in cases where it could be harmful for, you know, a child to hear certain conversations and so forth. When it comes to the data collection piece, you certainly have some room for clinical judgment. You might, you know, begin when you're first meeting a couple, if you have a large packet, with kind of going a more conservative route, like mail collection, or if you have a way to do the electronic collection privately, that would be an option. And then kind of from there, you can use the clinical history and the presentation of the family to decide whether, you know, you could move to something that's a little bit quicker, like a verbal response to some of those items moving forward. This kind of dovetails into another area that, of course, is a big concern for clinicians, which is around safety. You know, when we're thinking about safety for couples and families, there are some of the typical contraindications that we have for any type of couple and family therapy, but then there's also thinking through, like, where do we draw the line for telehealth with couples and families, you know, even outside of that. And so, you know, in many forms of couple therapy, for example, there is an exclusion around moderate to severe intimate partner violence. And so, you know, couple therapists then sometimes do see couples that are in more of the mild range of violence, you know, with the intent of working through that in the couple therapy. But, you know, we may have kind of different feelings about that when the couple is sitting right next to each other, as close as they can be to fit on a computer screen, and we're not in the room, and there's nobody that we know of that's, you know, physically around to intervene if, you know, if things were to kind of blow up. So that's one area that we think about. There's also a safety issue that kind of goes along with the privacy issue we discussed, which is that a lot of times, to assess whether there are these contraindications, we will have an individual session with each member of a family. So we will, you know, kind of check in one-on-one whether any of these issues come up. Is there alcohol use? Is there, you know, violence issues? And we can't ensure the way we can in our office that those conversations can't be overheard, unfortunately, because we are not there. So this is just another space that can concern clinicians when they're thinking about working with couples and families. Another is around the redirection of high expressed emotion. So, certainly when we're in our offices and there's a lot of high expressed emotion with a family, we have ways that we are trained to deal with that. And some of it includes some physical maneuvering, or asking someone to leave the room, or, different kind of tactics that, it feels like our physical presence is helpful in that. And it can be more challenging even just to interrupt when you're, doing something over telehealth. And then a final area that brought up by Alan et al. Is the idea of creating emotional safety. How do we make this space between us and the family feel as emotionally safe as the therapy room would in person? How do we kind of create that safe container? And this is something to be thoughtful about because for some people, actually, even just the modality of telehealth could be triggering in some ways. So, if there is a couple where one of the presenting problems is an online infidelity issue, then, kind of meeting over the very computer where this occurred is potentially going to be, bring up some emotions for the couple. So, kind of having some awareness around just what the modality brings up for people, and also thinking about, in terms of safety, how to hold boundaries around the session when it might feel like using the technology for the session kind of opens up the door for other forms of electronic communication. So, if you're using a program that has a chat function, you don't want to be getting chats outside of session from this family, right? So, kind of thinking about creating a safe container for the session, even though it's over, kind of across two locations. So taking each of those pieces, you want to start by doing your proactive safety planning. So, some of this is going to be very similar to what you would do in person. Certainly for any telehealth sessions, you're going to be verifying the current location so that, if you do need to send help in the case of an emergency, you know where to send that help. So you want to be really talking with the couple about, I'm going to stay on the line to help problem solve with you. If it's something that you can't help each other with, I will send emergency services. You also want to have, be able to provide resources where it's appropriate. If there are needs for other services. And you want to have a plan around high conflict when it comes up. So that could be things like, I will have a, signal. I'm going to make a T for timeout, and I'm going to say stop, or whatever it is that you're going to do to interrupt the action when you feel it needs to be interrupted. And their kind of agreement to comply with that. You can plan some cool down plans post session. So, if a couple is particularly high conflict, or a family has a lot of expressed emotion in a session, thinking through what each person's self-care plan is going to be after the session. How are they going to take space from each other to be able to come back together after the session when they don't have that, drive home to cool off, or whatever the case may be. And then, kind of setting the boundary that if we can't adhere to this plan, we may not be able to do telehealth, right? So if I can't interrupt you, if you make that impossible, then, or if you're going to mute me every time we talk, right, then telehealth is not going to be the right fit. So, being able to kind of set those expectations and set that boundary that we'll be revisiting this if this isn't working out. When you're collecting that individual information, there are some things you can do to help with the privacy issue. You can use headphones for the individual. It's not as practical when both members of the couple are there, but for those individual sessions, you can ask some yes/no questions so that your part of the conversation is not being heard. You can use a chat function if that's available, though you would want to be thoughtful about, if you're doing one session after the other, that you're closing out of that session and starting a new one so that the chat doesn't remain for the next person. And you can think about changing the environment. So whether that means having someone go to the car to ensure privacy or go to a different location, not driving, granted, but, to a private space, or even thinking about having an in-person session if you have concerns. And if that's possible, of course, a lot of times the reason we're doing telehealth is because that's not possible. But if it is, that's something you could consider doing to ensure that privacy. Then when it comes to that emotional safety piece, really taking the time to discuss the client's relationship with technology and those boundaries that might be easier to cross with technology, so that you're really, a lot of this is just around clear communication, right? Having these conversations proactively, not just when something happens. So that's a lot of the piece around safety. And then thinking about just managing multiple patients in the room. A lot of those logistics that you're dealing with in any session might become a little bit more challenging with multiple people. So things like lighting and sound, right? So, maybe you can set things up so that you can see one person, but the other person's in the dark, and, you have to kind of really adjust that. Likewise with sound, if they have like an external microphone or whatever the case may be, that it may be hard to hear everyone in the family. Even the seating arrangements. So just making sure that you have visual contact with everyone present can be a challenge. The other piece that comes up a lot with managing multiple people are some of the kind of unplanned absences from session, from one or more of the family members, or family members kind of leaving the frame during session. So some examples of this are things like, I've called into a session and have one member of the couple is present, the other one is making breakfast off screen, or kind of trying to multitask and finishing up their morning activities before coming together, and they're assuming, oh, you can just talk to that person until I'm done. Or just kind of some of the home distractions, right? So I can't tell you how many times the UPS person comes to the door during my sessions. That's one of those things that happens that can, kind of take people away. And when you're working with an individual, okay, maybe it takes them away. Maybe you make some agreements around, we're just not going to get the door during this time period. But oftentimes when you're working with a couple or family, it's really important that everyone's present. It's not just I talk to you and then I talk to you. It's that I need you to hear what I'm talking to each member about, right? We really need everyone there for the session. And so, so these kinds of absences can be challenging. Or somebody, can just show up to a session without the other person. Oh, that person's not attending today. They're not feeling it. And that's something that, maybe if it was in person, they would have called ahead to check, but I'll just call in and talk to you here. And, and so you end up kind of faced with these situations, I think sometimes more often when you're doing telehealth sessions. So thinking through what to do, we have to be flexible to some degree, right? Oftentimes there aren't other options for these families. That's why they're choosing to do telehealth. But we do want to be, clinically assertive about important things. So, thinking through some of those logistics, can we use different technology? Can we use the laptop instead of the phone to be able to, make sure that we're getting everyone the picture? Can we kind of change the location of this session so that, we have something set up at the end of the table and we can really see everyone? You might think about using multiple devices simultaneously if it's like really hard to see everyone's face because you need some of that feedback. So, you use your iPhone in this room and you use your iPhone in that room, and then I can at least see everyone. That won't work with every type of therapy, but there may be some situations where that makes sense. And you just want it to be this, kind of collaborative problem-solving experience where, you're doing the problem solving early and often, right? You're really, it's very difficult to assess the dynamics of a family if you can't see everyone. So you kind of just have to work through all that stuff. You also want to use your session time to encourage attendance of all family members. This is something that you have to talk about up front, that everyone needs to be present for session and the rationale for why. In some cases, telehealth can be helpful. So for the couple whose partner wasn't feeling it that day, would they be willing to talk to me? Can you check? Right. So, you can sometimes still get a session out of a situation where someone is a little bit hesitant, but you also want to be keeping in mind the conceptualization you have about that family. To what degree might you be, kind of colluding with the family dynamics if you're, kind of making some of those accommodations. And so, so those are some of the things to think about. You want to maintain that conjoint frame. So you want all family members present. Sometimes it makes sense to have, kind of split up family members and have additional individual sessions. But if you're doing that, you want to do it equally with all members. So you're not just going to meet with one partner of a couple because the other one didn't want to show up today. If you're going to meet with them individually, that's going to be something that you're thoughtful about and making sure you're doing it equally. It's also important to think about not just the distractions from other people, but the home life, but also having clients close or disable notifications for any other app or program or email or anything else that's on their device, because you don't want the technology itself to be a distraction. You really want them just to be looking at you when you're doing your session. The next set of challenges is around therapy process. I think this is one that a lot of, couple and family therapists, have some genuine concerns about. And, it's certainly the case that you could, while a lot of our interventions translate really well to telehealth, a lot of the things we do with just some kind of minor adjustments can be done fairly easily over telehealth. There is some opportunities to kind of miss some things, some of the more subtle interactional cues. Whether that's, you don't quite see that somebody's tearing up, or some of those early indications of affect, especially if there's multiple people and they're a little bit further away from you, it might be harder to see some of that. I had a couple where one of the partners would kind of like clench their fists whenever they had something that they had to say but weren't saying. And, you could see that real clearly in person, but when it's under the table, it's a little bit harder to see those cues. So, there are things that get missed, that can be a challenge. Also a lot of couple and family therapies rely in some part on concepts like joining and the use of physical space to, kind of help them maneuver things in the family system. And so, there's concerns, can we effectively do that over telehealth? And like I mentioned earlier, there's actually not a lot of empirical evidence for us to rely on to say, yes, you can. So it's understandably a concern. Another concern that comes up for clinicians is around the Therapeutic Alliance. Am I going to have the same rapport with people when I can't, kind of be physically there for them in their presence? And this one, we fortunately have a little bit more evidence on. So even in the review I cited earlier, overwhelmingly, the evidence points to no difference in therapeutic alliance between telehealth and in-person conditions of family therapy. So, so we know that somehow we're getting through, and then that kind of moves us into some recommendations, some ways of kind of helping with that. One possibility is to offer some alternatives. So you could offer an in-person session at the start of your therapy if that's something that's feasible for the therapist and the family. That would be a way to gain some more interactional data, kind of establish that alliance in person before you move to telehealth. Like I mentioned with one of the case studies, you could do individual telehealth sessions first to kind of establish rapport with each family member individually before coming together as a couple. That would be a possibility if they, if you got any indication that there was some hesitation or concern about meeting over telehealth. You're going to have to overall elicit more verbal feedback. So you're going to have to ask questions if you're getting even a hint of something, but you can't tell because you're not getting all the nonverbal cues. You're going to have to ask verbally, what's going on with somebody in their body or in their mind or in their feelings. We do that in therapy anyways, but it's just going to be a lot more of it when we don't have all of those cues. You're going to want to use tone of voice and speed of speech to have those moments of connection. So where you might kind of get closer physically or reach out physically, you're really going to want to adjust your tone as a way of connecting. You're going to have to use names more frequently to cue people. There's multiple people on the screen. It's not always clear who you're talking to because the eye contact piece is missing. So, you need to use names more frequently to accommodate for that. And there can also be some benefit to practicing the skills or, kind of getting a lot of practice in session with, some of the things you're trying to teach the family or teach the couple. The nice part about that is that there may be potentially some better kind of generalization since they're already in their home space. And so, so kind of giving them that chance. You'll have to do a lot of directing family members to talk to each other, right? Because when you think about it, everyone is around a screen looking at you. And so if you want them to be having a moment with each other, you're going to need to kind of give them that permission to break from you and talk to each other. Sometimes it can happen naturally, but that's something that you want to be thoughtful about as well. And then a final challenge I'll talk about is just around treatment planning. So when you're working outside of your community, there may be when you're trying to make referrals for somebody who needs a different kind of intervention or needs, individual treatment to go along with the couple therapy or family therapy, you may not know everyone in the community that they're located in. So you'll want to seek out resources and get creative with your referrals. Connect to any discipline in the area so that you can kind of network, gather resource lists, and also learn about other organizations that offer telehealth or telephone options. There's a lot more now since telehealth has become more prevalent. So gathering those resources to help. And then I've included just some resources and references. With the pandemic, a lot of types of couple and family therapy that may have been reluctant are now having to do couple therapy. And so there's a lot of lessons learned articles out there that I think you would appreciate.